radically and intentionally inclusive. Our core program is this meeting every week. We meet here Wednesday at 9 a.m. This is also going on all around the country, and we have 1 to 2 presenters that come. It's not a sales pitch. They present their business, where they are, and what they're trying to do, and then you, the community that attends, gets their feedback, ask some probing questions, and see how we can help them, and also connect with them as well. So that's what we're here to do. If you would like to apply to present, you can always go to onemillion.com/present. If you know anyone, you can share that URL with them to present. They can come and get some good feedback and build community with their business. Today's presenter, we have Eric. I'll bring him up in a minute and give him a more formal introduction, but we have our one presenter today. But before we do that, we like to do our resource round robin, and we're really just talking about what you can introduce, like who you are, what you do, or a resource that you have for businesses. So we'll just go around. We'll start with Cassandra.
Okay. So I've been making the rounds. I went to the the Future of Small Business event in Arlington this past Monday, and I learned about the World Cup for soccer, FIFA. So, sorry.
Peter Piper.
Sports person. But I'm sharing that with you all because it's going to bring a lot of opportunities for business in the Dallas area. So I'm going to do my best to find out more and then share that with the community in the weeks ahead. And that will be next year, but there are going to be all kinds of, I forget what you called it, communities in various towns also ahead of the event. So there'll be revenue opportunities. They even gave away free laptops at that event. Yeah, refurbished. But they had a subscription for Visa as a payment gateway, and they also gave away that little gadget where you can take credit cards. So that was kind of like the clincher or whatever. You have a laptop, you have the subscription, and now you can use Visa as a payment gateway. But, you know, it's cool. So I'll let you know more as I learn more. Thank you.
Thank you, Cassandra. Does anybody else have a resource they want to share or anything they want to share? No. Okay, that's fine. Well, moving on. Y'all give a hand for Eric. Come on up.
Woo-hoo! We love Eric. He brings donuts.
Okay, cool. Change your mind. This is the go forward.
Okay. Thank you so much. Howdy, y'all. Hope everybody's doing well today. We already had a little bit of a discussion, so I'll kind of just give a general rundown. You know, maybe you know this, maybe you don't. Everybody's seen the pink ribbon, but some people don't really understand the magnitude of breast cancer in the United States. Every year in the millions of women are diagnosed with breast cancer, and sometimes you've heard of stage 4 breast cancer. This is when the cancer has metastasized or is spread throughout the body, sometimes different visceral organs or chiefly the bones. And tens of thousands of women in the United States every year are told by their doctor, they go in, I'm sorry, you have stage 4 breast cancer, your cancer has spread to your bones and it's incurable. And the path forward for them is mostly they can have a systemic chemotherapy that basically more or less there's no targeting aspect to it. It's a very rough and intensive procedure that affects the entire body in a negative way. You see people with hair loss, fatigue, weight loss. There's also sort of palliative approaches or pain management, where you're attempting to, these people have cancer growing in their bones. Even walking is hard for them, where you try and slow the spread of the cancer. But right now, there's nothing that really is, an active sort of agent that works against the cancer, which is growing in their bones. And that's what we're working on at my company, Viridian Radiopharmaceuticals. We kind of stumbled into this field. I don't think a lot of people say, when I grow up, I want to be a pharmaceutical person. I think that it kind of is like a bad rap. It's not a great industry. Justifiably, it's kind of earned that, fine. We have a background in basically identifying certain atoms that are radioactive that can be used in different industries, whether that is defense or, energy, or in the case of pharmaceuticals. In this case, there is an entirely new field of pharmaceuticals known as radiotherapeutics, where you basically make a drug that serves as kind of like a homing missile with a radioactive atom attached to it, and it'll be injected into your body, and it'll go and attach to certain cells, cancer cells predominantly, and the radiation will kill those cells. And it's been shown to have a pretty solid increased overall survival rate, giving patients, months to like a year or multiple years, of additional life. There are 3 chief drugs that have been put on the market. The main ones for prostate cancer has been shown to be, pretty effective. We are targeting breast cancer, stage 4, which presently there's nothing on the market for this. It's more deadly than prostate cancer. There are more cases every year than prostate cancer, and it's just an unmet clinical need that frankly is just overlooked. Our drug is an existing drug that is multi-billion-dollar drug that is used to basically slow the spread. It's been shown that to slow the spread of stage 4 breast cancer, we just make it radioactive to allow it to fight back against the cancer. So now it's no longer just slowing it, but actively curing it. At present, we initial drug being able to slow down tumor growth before then proceeding to animal studies where we would be testing this on like pigs. So that's kind of a high level of our business, what we do, and where we're at.
Awesome. Thank you, Eric. We'll open it up for questions.
Not all at once now.
Is there anything you need, like your challenges? What were your challenges today?
It's funny, one of the hardest challenges is being able to find these research organizations that will do the preclinical testing for pigs, because there are so many organizations that will handle radioactive materials, and most of them just do mice. But we think that doing testing on mice is very bad. People are not mice; they're not even close. You've heard people called pigs before. Pigs are much more close in terms of size and body to a human, and so even finding the overlap in places where we can do testing with both pigs and radioactive drugs is hard. Outside of that, our challenges are really just getting hooked into the general breast cancer awareness network and such. There are a lot of great organizations out there, but the main goal of them is chiefly awareness instead of research funding. We come from outside of academia as well, which we view as a strength. Personally, I don't think that a lot of innovation I don't think that academia is the bastion of innovation. I think there's a lot of great stuff that comes out of it, but I feel like that you hear all the time that innovation comes from weird places. The Wright brothers, they were bicycle brothers, and the plane came out of them. But still, most of the funding goes to these institutions. These multi-billion-dollar universities, they get more money shoved towards them because these people have, understandably put in the work. Getting a PhD is no small task or empty, but it's difficult to be able to. We've been self-funding all this research and work, but it's difficult to, be able to kind of penetrate, through that noise, to get people to understand, no, we have some advisors who, very well understand this field, or some of the top researchers in breast cancer in the world, but being able to, hook in, and be able to get some of that, maybe that grant money reallocated in our direction is another difficulty that we're currently facing.
Is that the entire deck, Eric?
No, there's, I can go through it, it's really long, and there's a lot of
Oh,
words.
okay. All right, I was just curious. So you're saying you're looking to get tapped into a venture capitalist network or grants or?
Well, so mostly grants or angels. Like I said, we've been doing self-funding, and we can do this for a certain period, but nobody self-funds a drug through FDA trials. It's just not possible. It's too expensive. And so we need to start building that community because it takes a village to be able to see something through from inception to getting it into patients. Because the goal here is huge. Again, there's nothing that can cure stage 4. There's no cure for stage 4 breast cancer right now. This would be the first. And so we imagine that there's a lot of people out there. We just need to be able to connect with them. It's not like I'm saying like, no, trust me. This is like the perfect like NFT crypto wallet. It's like no. This is like something that we've all been touched by. I've had relatives that have been touched by breast cancer, lung cancer, prostate cancer. I'm sure everybody in the audience knows somebody. So it's a matter of just being able to understand, who's out there that, is a good advocate that we can, talk to and, kind of, I guess, do war games with insofar as where we go to make this into a reality. I mean, we're actively doing development, but we want to get ahead of things so that way we can fund our animal studies.
Okay. And do you belong to any organizations already? Are you familiar with the DEC network? Are you going to participate in Dallas Startup Week?
Sure. So we're like engineers and scientists. So we're not the most social group, but we are affiliated with we do have a partnership with the University of Texas at Austin. They're a nuclear reactor group, and we do have funding from the Department of Energy for the work that we're doing. Interestingly enough, they are interested in funding breast cancer research. The government's a strange place. We have not really. I'm somewhat new to the Dallas area, and so I haven't really tapped into it. I'm originally from Houston, lived in Austin for some time, and so I'm now really just starting to kind of get acquainted.
Thank you.
Yeah.
Okay.
How much are you looking to raise?
$1.5 million.
Okay. And are you actually like looking to like pitch, or what's like your strategy? Just finding grants, or are you doing both?
Both. Because again, our whole goal is to be able to, however we get to the end, we have our end in sight. We know our mission and what we need to do to get there. We're probably going to take a lot of paths, and we're going to look like chickens with our heads cut off to get there. But we'll take any avenue.
Got you. Have you like talked to any angel networks at all yet?
We have talked to a few, and a lot of them just say we're not interested in doing anything in pharmaceuticals.
Okay. Which ones?
There was like the North Angels. There's Goose in Houston. There is, there's one in Austin that's very big, that's well known. But I wouldn't say we talked to an immense number, but we put our feelers out there.
Gotcha.
So again, we're just kind of just beginning to take this off because we see again a very big bill from these companies that are going to be doing the animal testing coming down the line, and we want to make sure that we're there to pay it.
Gotcha. Maybe try, not a guarantee, but try the Baylor Angel Network. So they're in Waco at Baylor University.
Okay. Yeah, we know Baylor, Scott and White medical system have tapped into some of the oncology programs and some of the professionals there, and so that's a great. I didn't even know that they had that going on in Waco.
Yeah.
Very nice.
I'm kind of curious, like, what timelines for this looks like, because I remember like with COVID when they were developing the vaccines and stuff like that, it took them several months, and like that was fast. So, realistically, what does the timeline like from inception to application of this treatment look like?
Probably 18 to 24 months. So, fun fact, do you know how long it took them to come up with the COVID vaccine? I guess
3 months.
3 months? Any other guesses?
3 days.
3 days? Any other guesses? You laugh, it was less than 1 day.
What?
Less
Yeah.
than 1 day.
Yeah. So, I mean, people can really move on things if they need to. Now, there's a whole body of research that was, predating it, but, you can move things along in terms of, the actual trials. You can expedite things pretty quickly. We're fortunate in that our drug is, again, it's very well understood to repair healthy tissue. So we have it actually an expedited pathway that the FDA grants us because of that fact. So that, again, we have a much faster sort of route than most. Whereas a drug might take anywhere, between 5 and 15 years to, go through the pipeline. We might be, FDA approved in under 5. So.
Can you mention the name of the drug that you're currently basing your
Yeah. So the drug that we're currently basing ours on is called Zometa, and if anybody here has a relative that has osteoporosis, they may have taken it, or something called Fosamax. And so I'm going to give you some additional background information that you probably don't need to know, but it's relevant. When women go through menopause, their estrogen drops, and you have your bones are constantly being built and torn down all the time by these cells, osteoblasts, which build them up, and osteoclasts that break them down. And whenever the estrogen drops, it downregulates your osteoblasts, the things that build up your bones, and so there's a dysregulation in terms of that equilibrium. And so now you're breaking down more bone than you're building up, and your bones become porous, and you get what's known as osteoporosis. It is one of the reasons why a lot of women post-menopause get osteoporosis. And so they're prescribed Zometa or Fosamax, and what that does is you presently have downregulated osteoblasts, it downregulates your osteoclasts, so that way you have more of an equilibrium to either inhibit your bones from becoming more porous, or maybe it gets downregulated even more than the osteoblasts, so that way your bones can be built back up. And so that drug has been shown to slow the growth of tumors in your bones, and so via a very similar mechanism. There's a lot of sort of if A then B and B then C. I'm an hour after this, but our drug just basically takes the thing that slows down that process of your bones becoming porous, which also impacts the tumors, and makes them a therapeutic. So it actively attacks and radiates the tumors while sparing healthy tissue.
You said it takes like a village for what you're doing.
Yeah, 100%.
I'm new to pharmaceuticals. I just only know high levels. So what do you mean by that? Do you need doctors who are advocating?
Yeah. So I mean, we have been talking with clinicians, because another thing which is important to take into account is, when we were looking at we had a lot of drugs that we were looking at making, and this is the one that was the most, it seemed like the lowest hanging fruit, if that makes sense. Again, all we're doing is we're legitimately changing one atom in an existing drug, and that people are familiar with. It's a blockbuster drug. It's very good at what it does. And we talked to clinicians whenever we were talking about all the different sort of drugs that we were trying to make beforehand. We were getting either yes, no, or that, patients wouldn't be comfortable with this, or you have to take into account that these are radioactive, and sometimes patients won't take something because they don't feel comfortable with it, and so you have to make sure to take into account patient concerns, clinician concerns, handling of the materials, so understanding the supply chain, logistics. You need to be able to be speaking with key opinion leaders, people who have worked with the FDA, that have seen drugs through the pipeline. Obviously being able to have capital on your side as well. This is not a cheap thing to do, And so really being able to have the whole galaxy of everybody involved in the healthcare system is important. Even having, you know, a play in politics here, or, you know, being able to be closely, you know, affiliated with entire medical systems like UT Southwestern, MD Anderson, Baylor Scott and White, just so that way you have those resources in your corner to push this, because, you know, it's just a very long and arduous process, which is one of the reasons why a number of investors say pharma, not for me. It's a very long game, and it's a hard game, and the majority of these things fail. But the thing is that if nobody tries it, nothing will happen. So.
Are there like investors that focus only on pharmaceutical?
Yes. Yeah, there are. The difficulty is that a lot of pharmaceutical research is subsidized or done by tax or performed through the use of taxpayer dollars, and so you know, maybe there will be somebody working at a university who is asked by, I don't know, like Bayer or some other big pharma company to look and do some investigational research, and they can apply for a grant. The grant will go through, and they'll be able to do this research, and it's known as high-risk research. And once that high-risk research is done, that's kind of like this has got a chance or not happening. And once that research is done, that is typically where a company will be formed, either by the academics themselves or some people who are working with like a tech transfer office or a commercialization office within a university, or with that sponsoring company. And then outside capital will come in. Given that we find ourselves outside of the university, we don't really have that leisure to do that. Because this technology has all been developed by just, you know, in our own lab. So the normal venture groups that would fund this, they don't fund this early stage, if that makes sense.
A lot of challenges, Eric.
Yeah, but you know, it's an exciting space, and I mean, we're very confident in our drug, and that's our North Star, is, you know, being able to change the lives of hundreds of millions of people, or hundreds of thousands of people on a yearly basis. Eventually, hundreds of millions. We'll get there.
How can we identify people that can help you guys?
Honestly, anybody who has a close tie with breast cancer, frankly, because it may not be, like, they probably know what we're talking about, and it may not be that they're the one who can help in any specific way, but they might know somebody else, so it's kind of just that network effect.
Jokingly, have you tried running the marathon about breast cancer awareness?
I'm like 275.
I mean, it seems like a lot of people are like.
I'm gonna need something for knee awareness after that.
I'll do the research, but not run the marathon. I can appreciate that.
I'll do the turkey trot.
Jokingly, because there's organizations that, you know, fund that and stuff like that.
I'm going actually to the Society of Nuclear Medicine and Medical Imaging event in exactly a month from today, which is where a lot of these people kind of get together and like hobnob, if that's what you do as at these. Participating in, because you know, maybe I should be cardio once a year.
I'm glad to hear you say you're going to that event, because I think about the documentaries I've watched about somebody like an Elizabeth Holmes, I think that's her name. You know what I'm talking about?
The Rano scammer, yeah.
Yeah, but I mean, she was so well connected, but she was in Silicon.
I don't want to be thought of like her at any point in time.
No, but I'm
With the
saying she
turtleneck
was
and
so
keeping
well
my voice.
connected. And I think that's
Yeah.
that makes all the difference.
Masterful networker, 100%.
Yeah.
It's like they say that you know, Wozniak could have never made it without Steve Jobs, right? You need the business mind with the science mind, or engineering mind, right?
Do you have that on your team?
Well, it's supposed to be me, but you know, we're working on it. I have found 2 previous businesses and exited them, but it's been a minute, and this is a very different field. You know, those were both in software.
Gotcha.
So I think we're pretty like people, so.
Right. All right, well, May already answered it, but we always like to ask as our last question, what as a community can we do for you?
If you know anybody that's passionate about breast cancer, I'd like to talk to them.
Awesome. Y'all give a hand for Eric.
Thank
Thank
you.
All right, so that was our presentation. The next thing that we like to do before we wrap up is our community spotlight, and this is just if anyone has anything going on, any events that you know about going on, anything that you're doing with your business or trying to do, now's just the time to give you time to spotlight that if anybody has anything.
Arlington is having a small business expo. Unfortunately, I can't, my phone is up there, so I can't look up the date, but you can Google it. Arlington Small Business Expo.
Awesome.
I think it's May 29th. We don't know.
Awesome. Thank you. Anybody else?
I don't have anything.
You always got
I
something
know, I
going
don't have
on.
anything right now.
Okay, awesome. Well, the last thing, this is 1 Million Cups. We're 100% volunteer led. We all do this for free. We don't get paid. So if you know anybody that has time, wants to get more involved with the entrepreneurial ecosystem here in Dallas locally, it's really a great opportunity to meet people both through this event, but also through the other activations that we do and people that we meet in the ecosystem out in Dallas. So feel free to send them our way. We're always looking for volunteers. Before we wrap up, Eric, can you come back up? We just want to give you a gift for coming by. to us
Token of
today.
appreciation.
So,
Oh, thank you.
Sit there confident and tell me everything about 1 Million Cups. And then also, we want to give one more away to our newest person. So, Brian, go come up. I'm going to give you one, too. And you can think about 1 Million Cups Dallas. So, thanks for being here. Awesome. And that's everything. Feel free to stick around. If you don't know about Comerica Business HQ, you can go and talk to the desk and learn more about this space. It's 100% free for entrepreneurs, and they have resources here as well. Feel free to stick around and network and talk more as much as you like. Everybody, y'all have a great day.
Thank you.
so much.
Thank you.
What's a good way to connect with these people across?
LinkedIn, email, phone, GeoCities.
What's going on?
I know there's a way to scan something on LinkedIn, but I don't know how to do it.